to Restore Thrive. We are in what we will call barbell case study today. We're having pain with barbell lifts. So one of our friends in the power athlete community has presented with some very unique and specific symptoms around the base of their neck. And so what we're going to talk through today is how we suss out in physical therapy what is the root cause of your problem. Because there's a lot of people out there who will make recommendations for pain that are treating the limitation or the symptom, but not the root cause of the problem. So let's talk through first what the issue is. So our friend, and we're going to use Patrick as the stand-in friend, even though he's a real friend of ours, he's not the friend. Our friend is having pain at the base of his neck that's spreading out. Yeah,
there we go.
Basically at the base of the neck, top of the upper back, that's spreading across the back. Now what's interesting about this is a couple things. One is I asked him already to do some just basic range of motion testing with his neck. So he's flexed his head down, he's looked up towards the ceiling, he's turned his head right and left, he's done side bending, side to side, where he's bringing his ear towards his shoulder. None of this stuff reproduced his pain. So what we're going to talk about today, and Dr. Jess is going to help me with a couple of special tests that we would do for the neck, and then if we don't chase anything down there, what we would look at moving downstream into the upper back as well. So Jess, what are your thoughts as far as where we would start after kind of all of this?
Yeah.
Oh, one other thing. Two other things. So main pain generators are horizontal rowing, so pulling back, and barbell back squatting. So, all right, now do it.
Yeah, so a couple other comments I have with this. The reason why Tim said figuring out the pain generator is so important because we as PTs do entirely different things depending on what structure we feel is reproducing your pain. So I would do something different for a facet joint, for example, which is a certain joint in your back, versus a disc, versus something else. So we do different lifestyle modifications, different pain relief techniques, and different interventions. And we don't know what structure is causing your pain, our treatment is not going to be effective. So that is why that is so important.
Absolutely.
And like Tim said, if you've got pain right around this part of your neck or upper back, the neck commonly refers there, which is why we start with that screen first. Let's screen the neck. If your neck is causing this pain, when you move your head, that pain is going to be reproduced. That helps us figure out what's going on. So interestingly, with our friend, Mr. Patrick, the friend, that's not happening. So main neck movements does not reproduce that pain. So what we have to do is add, like Tim said, some special tests to figure out, can we reproduce that pain when we load other structures in the back? So we as PTs know that with pain right in the middle of the back, only central structures can cause pain there. So this is not a lateral structure issue. A facet joint is on the side of the spine, not going to cause midline pain. So that's the kind of cool thing. We've already got in our minds, I think I know what structure, but what part of the spine do we have that issue in? I'm thinking disc already. So anyhow, Patrick, go ahead and do the funny extension with chin tuck test. There we go. This is a funky test. People screw it up all the time. So this loads the discs in the lower part of the neck. Thank you. That would be the test we might do next to see, does that reproduce pain? If not, we're going to go ahead and screen the mid-back, the thoracic spine, because we've kind of ruled out and cleared things in the neck. None of that is reproducing that midline pain, so we move down to the next part of the spine.
Real quick, though, if that did produce, what would be a good way that you could maybe fix that?
Right, we would do traction, neck traction, which we have a great video on our Restore Thrive channel that you guys can check out, and it's partner assisted, so grab a buddy and try that. If it feels better, bingo, we know what we have going on. Of course, long term, we follow up with some stability and neck exercises to get you stronger through there, get you more stable. The mid part of the back can get really stiff and cause stress here. So we'd, of course, look here regardless to kind of figure out, do we have stiffnesses we have to address there as well. But thank you for mentioning that. Traction would be the thing we'd start with to see if that feels better, if that funky test is possible.
Now we talked about too, there's another test similar to that we can do with the neck as well.
Yep, go ahead and do like modified spurlings and kind of turn, and cut back, really give yourself a double chin. So yeah, we would check that.
This one's a little bit harder because Patrick's pulling in his chin, turning his head, and pulling his head back.
Yeah, and that just gets a certain part of the disc in the neck, just kind of loads that area a little bit more because sometimes there's really small tears in those discs and they can be funky and
We move on.
Yeah. So then we go down to the thoracic spine, the next part of the spine, the mid-back here. And we would go back to what we did for the neck. So we screen basic movement. So go ahead and flex forward, Patrick. Good. He's really trying to round through here, okay? Go ahead and extend. There's not much extension in this part of the back, but he's really trying to kind of lift his sternum. Not doing an awesome job. You're tight.
Or sorry.
And then relax. And then rotate. Yeah. Good. You can even turn the head to the left when you rotate to the left. So we always just do the back first. Go ahead and turn. And then go ahead and turn with your neck too. There we go. We do that last. And we kind of check back. So how does that feel?
Feels pretty good there.
Okay.
Yeah.
Go ahead and side bend. Yeah, you're not the actual patient, so it doesn't hurt, right?
No, that does not hurt on me.
No, we
Hopefully not.
don't know. We really don't know. So, but we would go through. These are all the basic motions in the mid part of the back: side bending, rotation, flexion, and extension. And we would do the same, exam that we did for the neck. We look at basic motion first and kind of figure out, does any of that reproduce the pain? And then we have similar special tests for that part of the back, like we did for the neck, to see, is that bothersome for the person? If so, we kind of have an answer as to what pain generator is.
Now, let's talk real quick too about, let's talk about two pieces of the middle back. So what if rotation with the head turn, or even turning and ducking the head down, what if that causes some pain? So Patrick, go ahead and turn to the left. So Patrick turns left with his head and then looks down as well.
Yep.
And that starts to reproduce symptoms again.
Mm-hmm.
What are we starting to
Yep.
suspect there?
Disc.
Right.
They're very common actually in the mid back.
Yep.
Commonly missed, but they are a common issue to have there. So
And we got a YouTube channel video.
we have a video for that, guys.
There's a video for
Partner
that.
Assisted thoracic traction. So that would be what you would want to do. And this is why this is important, guys, because if we just kind of blow through this and we go, it's a disc in your neck, and we do neck traction, we might not be isolating the area that's actually a problem and offloading the correct disc. You're not going to feel better. Then you're frustrated as the patient. We're frustrated as the clinician because you aren't better. So this is why differential diagnosis is really, really important. We're always doing that here at Restore Thrive. When you come in, we do a very thorough exam. There's like 15 different things in the shoulder that could be wrong with you, 15 different things in the knee. So, and we do different things for all of those as far as our intervention. So hopefully that gives you guys a quick little glimpse of what we do when you come in for an exam. This is very quick, but we get a lot of questions on what is physical therapy? What do you do? So we wanted to give you this video just to give you a quick glimpse of, an actual friend who's contacted us and said, hey, I've got pain here. What do I do? These are the things that hurt. This is what doesn't. We thought we'd come on here and just give you guys a quick glimpse of what we do. So.
Absolutely. So we hope you guys enjoyed this. Obviously, like we always say, you can leave a comment below. If you have a question, you can reach out to us here on YouTube or find us at restorethrive.com. If you've got a more specific question that you want to ask privately, info@restorethrive.com is a good place to reach us as well. So if you guys enjoyed this video, leave a comment, let us know, share it with your friends and family, and we'll talk to you guys again soon.